Well, good morning, everybody. I'm really thrilled to be here today and thrilled to be with three people who I have known to be extraordinary leaders as we think about progress in this opioid epidemic. And not only are they thought leaders, but they're action leaders at the state and local level in terms of giving us hope and optimism that by using evidence and data and science that we actually can make a change. And I think we've begun to see states and municipalities making major change in reduction to overdose deaths. I'm really excited to be here today because I do think it's really important for us to understand what's working, that there is hope, that there are over 20 million Americans, including me, who are actively in recovery, and that we can make a difference on a daily basis. So I want to thank all of you for being here today. And first of all, I'd like to start with Governor Wolf. And first of all, I'll say congratulations on your re-election.
Thank you.
Leadership matters. And I was actually on your webpage today and saw your action plan for Pennsylvania and saw your strong leadership position in terms of actions that Pennsylvania has taken for the opioid epidemic. So I'm going to ask you to start and ask our other panelists to talk about what undergirds your foundation and your strategy here, and how do you use evidence and data to really focus on those things that we know to be effective?
Well, we have to do what works. I mean, this is, as Mayor Bloomberg said, a disease that is killing people all across the country. And the tragedy is that we can do something about it. And in Pennsylvania, we have worked right from the outset. My Secretary of Health, Dr. Rachel Levine is here. And we have been doing things based on evidence, looking at things that we can do logically and rationally to address this problem. The goal is to make Pennsylvania a place where no one dies of substance use disorder.
Great, good. Dr. Scott, Rhode Island is actually one of those states that has begun to bend the curve on the overdose epidemic that we see. Maybe you could talk to us about what you think some of those strategies are behind why we're seeing progress in Rhode Island.
When Governor Gina Raimondo in Rhode Island established our overdose task force, we had 4 major strategies that we said would be very important to be evidence-based and data-driven, focusing on prevention, treatment, recovery, and reversal with naloxone. Our main goal was saving lives, and so treatment and reversal were the 2 prominent focal points. With that, we were able to put policies in place that helped us work with hospitals better. We established levels of care that required every hospital system in Rhode Island to maintain minimum standards of care for screening substance use disorder, testing for fentanyl, and referring people to care, as well as engaging peer recovery coaches. That has made a difference. We've also put the focus on expanding access to treatment. Dr. Jody Rich shared earlier the 61% decrease in overdose deaths for those released from incarceration because of our medication-assisted treatment program. We've used that type of data to say we have to continue to scale up access to medication-assisted treatment, all levels, meeting people where they are.
Great, good. Shanaza, you work at the clinical level. Maybe you could talk about the importance of clinical interventions in terms of how we need to mount a robust response around this issue.
Absolutely. So we know that medication works, and we know some of the barriers are that providers don't actually offer medication. So we work very closely with our city Department of Health and our state Department of Health to figure out what are those barriers. So we know people feel like they're inadequately trained, and so providing training for free in a convenient location at their own clinics or medical centers is something we do. We also provide support for providers because often they feel like they need support to take on the treatment of addiction. And so having like nurse care managers available, which are supported again by our city and state Department of Health, can really be effective and get doctors to take this on. And then finally, we also provide mentorship. So there's a cadre of physicians who have experience and expertise and work with other physicians who are newly prescribing medication and taking this on and are really there to help in case people feel stuck or in case there are challenging cases or scenarios. And so I think we have to think about all of the barriers that we know exist for providers and really address them to be able to scale up life-saving medication.
Great. You know, one of the issues that we've known for a long time that presents a barrier for people accessing treatment is lack of insurance coverage. And I think that we're beginning to see at the state and the local level. There was an interesting article in the New York Times about Dayton, Ohio, where the mayor talked about Medicaid and Medicaid expansion as fundamental to our strategies here. And Governor, I know that's been particularly important to you. Yep. So maybe you could talk a little bit about the role that you see Medicaid and Medicaid expansion playing.
No, I think we are doing a lot of things, including having declared a disaster emergency in Pennsylvania. But it started with the expansion of Medicaid. We have 125,000 Pennsylvanians who now, their providers are getting reimbursed for treatment for substance use disorder. Had we not expanded Medicaid, that would be a huge gap in our efforts to address this epidemic.
Great. Nicole?
Medicaid expansion is critical, and certainly when you look at federal policies that are needed, making sure that the ACA and the ability to expand Medicaid is protected at every level is certainly going to be a very necessary arsenal to our ability to overcome this epidemic. We also have state and local policies that we know are critical, continuing to put the community forward and making sure that those who are in recovery or the families affected by recovery or by addiction and the communities that are devastated by it have the support and resources and the voice they need to change policies and systems and make it so that there's an opportunity to improve and overcome this epidemic at an equitable level.
Great. Shanaza, how does that manifest itself at the clinical level in terms of people's ability to have coverage and care?
Yeah, I mean, it's absolutely critical. I mean, so, you know, covering both office visits and medication is essential. And so we see patients, I'm in the South Bronx, and so most of our patients have Medicaid. And in New York, we've been you know, very generous in allowing Medicaid to really cover life-saving treatment. So it's been critical. I think the other thing is around naloxone. This is another area of expansion where having standing orders by the commissioners of health in the cities and in the states is really an important point of access for people to be able to get naloxone and for insurance to cover that in pharmacies.
Great. You know, people who were testifying right before we came on stage talked very compellingly, and particularly Peter, on the role that stigma plays, that we can have the most robust treatment systems, but unless we firmly diminish some of the stigma, that people won't ask for help. And we also know that stigma manifests itself on the public attitude and the public policy level. So maybe you could talk to kind of actions that you've seen as important or things that we need to continue to do to diminish some of the stigma associated with addiction.
But in Pennsylvania, we need to talk about it. We need to get this out of there. This is a medical epidemic. This is not a moral failing. And we need to understand that. And as we do, people will go into treatment. And I think this is one of the reasons why we've now brought 20,000 instances of lives saved by naloxone just in Pennsylvania. When we started, it was tough to get some of the first responders to even carry naloxone. And now, 2 weeks from today, in every health center in Pennsylvania, we'll be giving free naloxone to anybody. Our Secretary of Health, when she was Physician General, gave a standing order to every Pennsylvanian so that every Pennsylvanian has a prescription, can use it. And I think getting beyond the stigma allows people, first responders, patients, people who need this, who have loved ones who need this. Getting by the stigma allows us to embrace the problem and try to address it.
Let me ask a follow-up question. Why is your, and I'm leading the witness here, why is your voice at the state level critical to diminishing some of the stigma? Why is it important for you to talk about this?
That's a leading question. I was hoping.
I think it's called a softball.
No, I think I've gone around. We have maybe hundreds of round tables. I've led 80 personally, going all over the state. This is a problem that affects every corner of Pennsylvania, rich and poor, Republican and Democrat, urban and rural, north, south, east, west. There is nobody, no family that doesn't know somebody in Pennsylvania who has been affected by it. So everybody is affected, and we need to say, don't cover this up. Don't be ashamed of it. This is a medical problem, and let's deal with this because we can deal with it. We can do something about it, and I think that just it needs people all over Pennsylvania, everybody in any position, just stand up and say, yeah, let's deal with this.
Great, good. Cool.
One of the most consistent challenges we had seen over the last few years with our statewide strategic plan was the negative public attitudes component. It impacted every element of those 4 strategies: prevention, treatment, recovery, and reversal. And so now that we're doing a strategy refresh, we have addressing negative public attitudes as a key goal and part of overcoming some of those challenges. Our governor similarly has activated a mental health executive order where we have been having mental health talks throughout the state to really bring the community's voice forward and to normalize conversations about it being okay so that people can access the treatment, the prevention, recovery, and reversal services that we know truly save lives.
Great. Great.
In New York, our city Department of Health has a campaign that really addresses stigma head-on. So there are bus ads, subway ads, TV ads, and where people come forth, talk about them having addiction, them getting treatment, and how that's really changed their lives. So that's an important thing. But I just want to also add, the governor has said about this is a medical problem. So I really think that taking this on as a medical problem is important, but historically our systems are not set up that way. So drug treatment is very marginalized for the most part in our society, and I think to address stigma, we have to bring it into the mainstream medical care. And so that means, as a primary care provider, I treat diabetes, I treat heart disease, and I treat addiction. We need to do the same thing in emergency rooms, we need to do the same thing in our hospitals, and not marginalize it, but bring it in and mainstream it with the rest of the healthcare system.
Great. I want to follow up on that because I think we heard from Jody Rich in Rhode Island, and I think that we see the extraordinary mortality of people who are coming out of our jails and prisons who are often don't get good evidence-based treatment behind the walls. The mayor announced an initiative in Pennsylvania to look at integration of addiction treatment and medications in our criminal justice system. So I wonder if you could talk about the importance of that strategy in terms of not only reducing overdose death, but getting people back to work and back to productive citizens.
Yeah, we have a lot of things to do. A small thing, if you know, people who go to prison are treated by the medical system within the prisons. So in the past, you would terminate Medicaid. When you come out, it takes 3 months to get signed back up for Medicaid. So we stopped doing that. We suspended Medicaid while you're in prison. And the day you leave prison, you can actually start your Medicaid. So that simple thing has helped in reintegrating people back into the healthcare system. But again, I think you're right. We need to look at this issue everywhere as a medical issue. This is a chronic disease, just like diabetes, just like congenital heart disease. And we have to treat it as that, and our medical system has to embrace this.
Great. Nicole, maybe you could share some lessons. So how did you implement this in Rhode Island? And are there lessons learned that other people can take in terms of how they do that at their own state level or at the county or local level?
Absolutely. We started with seeing the data and knowing that rates of overdose deaths were higher from those who were released from incarceration. We also saw that almost a quarter of people with substance use disorder actually contacted our corrections system, and there was an opportunity for us to engage. So similarly, we made improvements. Instead of weaning people off of methadone or other medication-assisted treatment when they became incarcerated, we began making sure that everyone had access to all 3 forms of medication-assisted treatment. We also have begun screening people who are incarcerated for substance use disorder and have engaged the program to make sure that prior to release from incarceration, they are already engaged in a treatment and recovery services program. So I definitely credit Dr. Jennifer Clark, our medical director of corrections, for being a pioneer and leader in pushing forward, and certainly encourage corrections facilities throughout the nation to follow that model. The 61% decrease in overdose deaths is something that we can all benefit from nationwide.
Great.
And in addition to providing the treatment in jails and prisons, I think a big issue is that once people are released. And so we have a transitions clinic started by one of my colleagues, Dr. Aaron Fox, which is specifically for people who are being released from jail and prison and really provides accessible treatment, so people can just show up on a Saturday morning and they can get treatment reinstated immediately. Again, not just for their addiction, but for all of their chronic illnesses. And so I think models of care, really rethinking how we deliver care is important, particularly for marginalized populations that are at very high risk of overdose.
Great. I think we heard compellingly from the people who were on stage before us about the importance of people with lived experience involved in the policy and decision-making, whether that's a parent who's been affected, a person in recovery, or a person who's still using. And so how does that infuse the work that you do? How do you think about incorporating people with lived experience in the work that you do?
I think one of the things all of us as policymakers have to do is listen. We have to go out and actually ask people, what is your experience? How would you have done this differently? How can we do something differently? Great. We need to listen.
Yeah, hearing that voice is critical. We're constantly humbled and are able to make adjustments because we hear the reality of what will work, what's actually happening out in the community. And it helps shift our focus so that the community's voice, whether you've been affected as a family member or someone living in recovery now, can really lead the way and policies can follow with evidence and data to back it up, to really have the impact that we know is possible.
Great.
I'm in a community health center, so we are very much involved in the community, and we've been partnering with community-based organizations, harm reduction organizations, and syringe exchange programs for decades, and listening is critical. I mean, just one example is we heard people say, we want buprenorphine treatment at the syringe exchange program. So now we're actually studying that. And again, rethinking the way that we deliver care is critical.
Great. So we have about 10 seconds left. So each of you I'll give you 10 seconds to respond to this question. What one additional thing do you think that you need to do, and what support do you need either from the federal government or any other entity to make sure that happens?
I think we need a confidence that we're going to have consistent help and that there's a broader recognition at the federal level that this is, in fact, a medical problem.
Great. Great.
We've put the systems in place. Now we need to make sure that everyone has access to it. And we've made our focus be make sure that we can reach people and meet them where they are. And we need the support at the community level to help us do that.
I think we need at the federal level to really incentivize medical schools, residency programs, and healthcare systems to provide the education and treatment. And I think it has to be done sort of at a much larger level at the federal level.
Great. Well, thank you all. Let's give a round of applause.